Sarah Game is One Nation MP in Parliament's State Upper House. Good morning, Sarah Game.
Good morning.
Sarah Game, why did you vote with the government?
Well, look, on this instance, and Chris Picton and I don't often agree, actually, but on this instance, I just felt the government had done their absolute best. There were lots of factors to consider, but I think Chris actually summed it up really well then. There's been lots of delays, and ultimately for me, the health of women and children come first. I was contacted by lots of different clinicians, and really there was just unanimous support for the government's decision and that this hospital needed to go ahead. I guess the other thing to understand is, parliamentary inquiries and committees, they cost time and money. You have to think very carefully about when you're going to set one up. And on this instance, I think it's better to just get on and build the hospital that we so desperately need.
This is a project where the cost has blown out by $1 billion. We were promised it would cost $2 billion. It's now going to cost $3 billion. It's a project that's not on the site where we were originally told, and when people voted at the last election, this was a big issue. They thought it would happen in a certain spot by a certain time frame. That's all blown out, and the alternative is actually on a heritage-listed precinct. You don't think there are some questions there? An inquiry wouldn't get in the way of the government using the powers that you were happy to give it, but we could at least get some answers to some questions.
Well, I think it would definitely cause a delay, actually. We don't know how long the inquiry or the committee process really would take. And, having been part of committees now, you've got people on, politicians on a good salary, sat around, listening to information. I think you have to think very carefully. And on this instance, I think it's better to get on and build the hospital. But I'm also very keen and hoping that I'm going to be able to talk to you about another public health matter that I'm introducing today, which is a controlled substance amendment bill to allow regulated vaping products to be sold from licensed retail outlets, which I think is also a very important issue.
I am very happy that you raised that, Sarah, because while the government looks like it might have parlayed with SA Best, giving them what they want, and I don't know whether that's related to their support for the Women's and Children's Hospital, but they've thrown them a couple of bones. They didn't back you on your vaping bill. What's going on there?
Well, exactly. I haven't, unfortunately or fortunately for me, I've just voted with the government on this occasion because I thought it was the right thing to do rather than any horse trading that's gone on.
So you just used your conscience.
I did. We'll see how far that gets me in the political game. But look, I did speak to Chris last night about my vaping bill, which I just want to explain clearly for anyone listening, because I think, there are some misconceptions. There are really sort of two main types of vaping products. You can get your black market vaping product where it can be labelled as having zero nicotine when in fact it's high nicotine and it's really of unknown constitution. That's not the type of vaping product that I'm talking about. I'm talking about a regulated vaping product that you can currently get through the pharmacy that contains a flavouring, solvent and a low-dose nicotine. It's supported elsewhere in the world as a smoking cessation tool. And for some reason in Australia, and we are the only Western country, we have this very high barrier system for those that want to quit smoking. They have to find a GP. Only 1% of GPs are authorised to prescribe for these nicotine vapes. They're not allowed to advertise that they provide this service. We have very low stocks in our pharmacies. And as a result, something like 2% of adults that want to quit smoking are purchasing these regulated nicotine vapes through the government-preferred model, and the other 98% are fueling the black market, which is also harming our youth. So for me, this is a bit of a no-brainer, and legislation like this has passed recently with bipartisan support in New Zealand and is actually promoted in other countries like Canada and the UK.
Okay, so there's a lot of information there. To back up a bit, would your bill have made it easier to get vaping products or harder?
It's going to make it easier to get a regulated vaping product which is safer and different than the vaping products on the black market. So what we've got at the moment is It's very easy to go and get a black market vaping product. I mean, I haven't purchased one myself, but from what you read in the media, youth are purchasing black market vaping products all the time with ease. And somewhat nonsensically, it's very difficult to go and purchase a licensed, regulated vaping product, which is 95% safer than smoking. So if you want to go and buy a packet of cigarettes, you just go to the service station or supermarket or convenience store. But if you want to buy a smoking cessation tool, a regulated nicotine vape, you need to find a GP, get a prescription and go to the pharmacy. It makes no sense.
We've got a text here from Louise from Woodford. She says, vaping is a huge issue with young people. If Sarah Game is serious, she would simply ban it.
So what's happened is this new law where we have essentially made it very difficult to get nicotine vapes only came in about 12 months ago. And since that law came in, we've actually seen a booming black market. So the facts speak for themselves. By actually banning the licensed, regulated vape from being sold in convenience stores, we've actually created this booming black market of these unregulated products. And it's been shown in other Western countries that the way to get rid of this illicit market is to have a legal, regulated market, and then we're starving the black market. I don't want to see youth vaping. And this policy that I'm wanting to change is about saving lives, and it's about reducing youth vaping.
Well, Nadia says vaping is becoming a massive issue with youth in schools. Getting black market vapes is too easy for the 12 to 14-year-olds. Do you think Nadia's onto something?
Well, she definitely is, because what's fueling that black market as well is the 98% of smokers who are trying to quit smoking who can't get a regulated nicotine vape.
Right.
So they're just going and buying it from the black market source, and these shops are thriving while our previous licensed vape stores have closed down.
The bit I heard of Chris Picton, the Health Minister, talking to Nicola and Stacey this morning, I think he was saying, look, I respect where Sarah Game is coming from, but we want national consistency. So he wasn't interested in supporting your idea. But and the reason for that was he says, well, no, we've got to have a national consistent approach to this. Do you think he's just looking for reasons not to support you?
Well, what I just want to make really clear is that we are the only Western country to have this policy. I mean, the UK government actually supports this, Canada, all of the rest of the Western countries, you can buy these vapes. We are standing alone with our policy. And when I spoke to Chris last night, it just doesn't make any sense. You know, we've seen the effect of this new government policy. It's led to a rise in youth vaping. And we really need to start putting science before ideology, I think, here. It's a public health matter. And the government policy is actually harming those who are most vulnerable the most. You know, we know that Aboriginal and Torres Strait Islander communities have very high smoking rates at just over 40% compared to non-Aboriginal South Australians at just over 13%. And we also know that those from low socioeconomic hardships areas tend to have higher smoking rates as well. Very expensive to smoke. If you're a pack-a-day smoker, it can cost up to $15,000 a year. Whereas at the moment, if you switch to vaping, one of these licensed regulated vaping products, it will cost just over $1,000 a year. And we should be doing everything we can to assist anyone, really, particularly those vulnerable in our community, to stop smoking. And it makes no sense that you can go and buy harmful cigarettes more easily than a regulated nicotine vape. And it's costing lives.
That's the voice of Sarah Game, SA One Nation MP. Excuse me. Let's go to Louise from Woodford. Good morning, Louise.
Good morning, David. Good morning, Sarah. Look, I just want to say thanks to Sarah, firstly, for for bringing this issue up. I have a teenage son. He's in high school. I've had to have conversations with him about vaping because, you know, he smells the mango, the grape in the air, in the toilets, on the bus. Kids are doing it. And I think the cost factor is what prohibits people. And I think the way that the licensing model works, if it's $1,000, then that's going to help people quit nicotine. We know what the damage of nicotine is. We're not addressing it enough with young people. Yes, the black market needs to be addressed. And I think, you know, looking at models to do that, absolutely. But the way we have it right now, if it's $1,000, then I'm happy for that system because that's something my son's not going to afford and it's not going to get him into it.
Louise, thank you very much for your thoughts. Lots of questions and texts coming in on this. Somebody, Bassett says it's almost as bad as e-scooters. Another listener says, in regards to vaping and related products, as someone whose mother is suffering from the side effects of smoking, why would anyone, in the interests of their own health, consider inhaling anything and potentially causing further damage to their lungs and bodies? It baffles me, says this listener, that the solution involves doing more of the same, but apparently it's safer. And Sarah Game, just to finish with you, that's your point. It might not be desirable, but you're saying it's at least it is safer than cigarette smoking, and we're throwing roadblocks in the way of something that's not as bad for you, while it's still easier to get the really bad thing, which is the cigarettes.
Absolutely, and I just want to finish by saying, you know, the UK government commissioned a review of over 400 published studies, and that showed that vaping, these regulated products, is 95% safer than smoking. And so for me, it's important that those products, which are much safer and have been proven as a useful cessation tool, are more easily accessible.
Yeah, I've got to ask you this, and I don't mean any offence, but just for transparency, have you been given any donations from companies that are promoting vaping, or, you know, have you got any? Has anybody helped out the Sarah Game campaign on that front?
Oh, well, you'll be surprised to know that no, and I don't smoke or vape, and I haven't received any donations from any, actually.
Okay,
Yeah.
So you're just doing this because you think it makes sense?
I'm doing this because it's just the right thing to do. It's really the same as the hospital vote. With regards to youths, I do want to point out that youths are also suffering from losing their parents and loved ones to smoking-related deaths. Okay. You know, millions of Australians are smoking and they're dying from smoking, and that needs to be a factor as well. All
right. Well, Sarah, again, thank you for talking to us both about the Women's and Children's Bill, which went through last night, and your vaping proposal. And Chris Picton, as I say, was also asked about that, and the government said, well, no, we're not going to support the changes that Sarah Game wanted to introduce in the Parliament. He was talking about that with Nicola and Stacey this morning. And